Okay, let's jump right in. So you have diabetic retinopathy, and you're about to start a medication like Ozempic or Wegovy. You definitely want a clear plan for your eyes, right? Not just a vague, oh, we'll keep an eye on it. So today we're going to turn all that worry into a simple, actionable monitoring plan that you can literally put into motion in the next 5 minutes.
And this really gets to the heart of it, doesn't it? The real anxiety isn't about the shot itself. It's about that gap, that space between when your body starts changing really fast and when your eyes actually get checked. And that uncertainty is exactly what we're going to eliminate today.
That is the million-dollar question. And the good news? The answer is a really straightforward 3-part strategy that puts you back in control. Let's build it together, step by step.
So first, we've got to understand where the risk is actually hiding. And you know what? It's not necessarily the drug itself, but that period of rapid physiological change that happens right at the beginning. Your body is adapting, and that's the specific window we need to zoom in on.
Okay, let's map this out on a timeline so it makes perfect sense. Right at week 0, before you even start or just as you begin, you get a baseline. That's your documented starting point. Then, from about weeks 2 to 6, as your dose is going up, that's what we call the highest risk window. This is the blind spot we need a plan for. After that, once your dose is stable, you can settle into a much more regular, predictable monitoring rhythm.
Now, you might hear this really scary-sounding term, early worsening. It's important to know this does not mean the medication is bad for you or is destroying your vision. It simply means that while the long-term goal of better glucose control is fantastic for your eyes, the short-term, rapid changes can be a little bumpy for the retina. And that potential bump is exactly why having a proactive plan is so important.
And here's the bottom line. We can't just wait until our vision feels different. Why? Because symptoms are what we call a lagging indicator. Things can be happening in the back of your eye long before you ever notice a change. A proactive schedule always beats a reactive scramble for an appointment.
Okay, so we've defined the problem. We know what we're up against. Now for the good part, the solution. Let's talk about how we can build a smart, proactive schedule that gets rid of that worry and puts you firmly in the driver's seat.
And here it is. This is the core of everything we're talking about today. Your plan has 3 simple but really powerful parts. Number 1, get a baseline snapshot. Number 2, schedule a recheck that's specifically timed to that early dose increase window. And number 3, settle into a stable cadence that's matched to your personal eye health. That's it. Simple.
Let's dig into that first step. I absolutely love this before photo analogy because it's perfect. Without a clear documented baseline, any future conversation with your doctor about changes just becomes a guessing game of, I think it's worse, maybe? A baseline turns that vague feeling into cold, hard, measurable data.
So what makes a baseline actually useful? Well, you need to ask for these 3 things specifically. 1. What is my exact retinopathy classification? Is it non-proliferative, NPDR, or proliferative, PDR? 2. How's my macula doing? Is diabetic macular edema, or DME, present? And 3, and this is crucial, can you please put the recommended follow-up time in my written visit summary? Getting these answers turns a routine checkup into a powerful strategic tool.
Now, of course, this isn't a one-size-fits-all kind of deal. The timing of your follow-ups, how aggressive they need to be, has to be tailored to your specific health history and whatever level of retinopathy you're starting with.
And this lays it out perfectly. Just take a look and see which one of these columns sounds more like you. If you have no known retinopathy and your A1C is pretty stable, a simpler plan might be totally fine. But if you do have known retinopathy, you've had treatments before, or you know your A1C is about to drop quickly, then a much tighter, more structured plan is definitely the safer way to go. And hey, when in doubt, always default to the tighter plan.
You know, if all this feels like a lot to remember, let's just boil it all down to one single powerful question that unlocks everything else. At your next visit, just ask your eye doctor this. Do I have NPDR, PDR, or DME, and what stage is it? Getting that specific answer written down is the foundation for everything. It tells you what kind of monitoring schedule you need, and it gives you the clarity to really be a partner with your doctor.
Okay, let's tackle those scary headlines head on. There's a lot of chatter about vision changes, but just saying your vision is blurry isn't a diagnosis. We need to be able to sort the real urgent signals from the more common, temporary shifts that can happen as your body adjusts.
This table is your cheat sheet for sorting it all out. So if you're getting some gradual, mild blur, it could just be the lens in your eye adapting to the new glucose levels. Definitely mention it at your next appointment, but it's probably not an emergency.
But if you suddenly see new floaters, flashes, or something that looks like a curtain or a shadow, that is an urgent signal for our retina evaluation. And any sudden significant vision loss, that's a true same-day emergency. No question.
Let's be absolutely crystal clear about this. These are the undeniable red flags. These symptoms override any schedule you might have. If you experience any of these, you seek same-day urgent care. No waiting around, no second-guessing, period.
All right, we've covered the why and the what. Now for the final, and honestly the most important part, the how. This is your 60-second action plan to take everything we just talked about and put it into motion right now.
It literally does not get any easier than this. We are giving you the exact script to send to your doctor through their patient portal. Just copy and paste this message. It's short, it's specific, and it hits all the keywords your clinical team needs to hear to get you scheduled appropriately. Go on, steal it. So to wrap it all up, here is your entire playbook on one single slide. 1. Get your baseline snapshot, making sure you know your stage and macula status. 2. Schedule that titration timed recheck. 3. Settle into a stable cadence that matches your health. And always, always remember the urgent override rule. This is your no surprises plan.
And listen, I want to leave you with this final thought. You do not have to carry the burden of deciding if this medication is good or bad for your eyes. That is not your job. Your job is so much simpler and way more powerful. Get your baseline, time your follow-up, and know the urgent signals. You're not an anxious patient. You are the calm, prepared operator of your own health plan.
So, I'll leave you with just one final thought, one final question to get you moving. Have you sent that message yet?